Well, a warm welcome to today's talk. It's Wednesday, the 29th of December, and I guess what we could call a tsunami of cases of Omicron is continuing, but it's looking like the hospitalisations are not. So it's still going roughly the way we anticipated it would. Now let's start off with this slide from the United States here. Now this is really quite dramatic. You can see the line here. This is completely genuine. This massive increase in cases, and for orientation here, this is the 400,000 a day mark. So I think we're pretty safe in saying there's 1 million new infections in the United States at the moment per day, because this is picking up the cases that are actually detected by testing, and we know there's been great difficulties with testing in the United States. And that's well over 400,000. So no question now that Omicron is taking hold in the States. Now, the CDC actually messed up slightly. They actually said that the Omicron cases were higher about a week ago than they actually were, because we were surprised that they'd gone up as quickly in the States. So it turns out the CDC actually got it wrong. But this is definitely well and truly kicked in now, as we see on that really quite impressive graphic. Now, this second one is the UK Omicron cases in terms of percentages. So this is today's data. This is the 29th of, well, this is for 2 days ago, but it's updated today, the 29th. So the purple line is the amount of Omicron, the green line is the amount of Delta. And we're seeing now that Omicron are up to 93.1% of cases. And we also see that the green lines are getting basically smaller, indicating, as we've said before, that Omicron is displacing Delta, which of course is the best news we could have, I would have thought, because it's causing less severe disease. So we've got a virus causing less severe disease, displacing a virus which causes more severe disease. Now, this is the cases in London. 96% now are Omicron. And again, we can clearly see that the Delta is being squeezed out in London. Not much Delta left at all, which is good news because the Delta causes more severe disease. Now, this is UK cases. And again, similar trajectory to the United States, really. This is genuine. Huge increase in cases in the United Kingdom. And of course, these are cases, which is only a subset of infections. So we know that infections are going to be higher than that. So we see that the cases there, 183,000 actually diagnosed in the UK. Now, the next slide is hospital patients. 8,264. Now, when you actually look at the admissions are going up slightly, but the average stay in hospital is lower. It's about 3 days for someone who's admitted with a positive coronavirus infection. So the actual number of patients in hospital is not going up. It's staying around about just over the 8,000 mark. So that's pretty good news. Deaths within the last 28 days in the UK, well, they're down 34.1% in the last 7 days. This is really good news and consistent with the idea that the Omicron is less severe than the Delta. And again, we can see the deaths are going down really quite dramatically there, which is exactly what we want to see, of course. Now, this next slide here, this is patients on ventilated. Now, we don't know whether these patients are actually ventilated or on ventilated beds in intensive care, but we can see the number is going down. So we're not seeing the number of patients who are hospitalised going into intensive care that we have seen. And again, to put figures on that one, 842 patients in beds which are capable of mechanical ventilation. So again, good news, less people are getting severely ill. And the South Africa data here that we've been keeping an eye on for some time now, cases in hospital, currently in hospital in South Africa, now down to just over 9,000. And of those, we see that 674 are in intensive care and 612 are in high care. So we're not seeing an increase in hospitalisations in South Africa, despite the fact that Omicron has just wiped through the whole country, basically. And we're seeing 1,328 patients in all of South Africa, population of 60 million, currently requiring oxygen. So this is going really as well as we'd hoped. And just another quick glance at the cases in the UK. So this is from the COVID symptom tracker data. 2 million people currently symptomatic in the UK. 192,000 new cases in the day, and the prevalence now we see is a fair bit over the 2 million mark, 2,079,000. And likewise, if we look at the hospitalisations in the States, we do see they're up slightly. But of course, the Delta cases in the United States were quite a bit higher than we thought. So I think that some of these hospitalisations in the States, well, we can say pretty well for sure that quite a few of these hospitalisations in the States are still due to Delta. And when the Omicron increases, we would expect these cases to become less. Maybe to show you a couple more graphics while we're on the graphics bit. These are new cases in various countries. So Canada going up, United States going up, France is that line there going up, Spain, again Omicron hitting, United Kingdom cases going up, Ireland there going up. Denmark, it looks like they might have just started to go down, but Denmark has been very high. And remember, this increase in the States is despite the limited availability of testing in the States. And we know about the huge problems and difficulties there's been to get testing in the States. So, as we said, the infections in the States are going to be way higher than this line here, which indicates the diagnosed cases. As we've said, a small subset of infections. New COVID patients in hospital per million. Now, the United States still fairly high, but we believe a lot of that is Delta. France, it's increasing. We believe a lot of that is Omicron in France, but we don't know how much. But I am going to give detailed data on the United Kingdom, which will illuminate the US and the UK situation. Spain hospitalisations are going up. United Kingdom a little bit, Denmark a bit, Ireland not. Interesting. Ireland, the hospitalisations remaining low. Canada hospitalisations going up, again, a small amount. So this is the data we've been keeping a look at here. 24th of December, Omicron hospital patients for all of the UK, 366, 29 deaths. 27th, that went up to 407 Omicron patients. Then there was an extra 261, then another 98 yesterday. There's now 766 patients in hospital with confirmed Omicron. And remember, that's out of 8,200 patients or thereabouts, as we saw on that graphic. So the Omicron patients in hospital, still a very small percentage. Omicron deaths 2 days ago, 10, another 4 in the past 24 hours, making a total of 53 Omicron deaths. But again, we assume these had comorbidities. So we are not seeing a dramatic increase in Omicron hospitalisations. Now, the news actually gets better than that, because new data from England, this is just for England, not the UK, estimates that 20% of COVID admissions are caused by viral complications. That means 80% are not. And that was data as per the 21st of December. So as we saw in South Africa initially, about 70% of the patients that were admitted to hospital were admitted for reasons other than, well, they were diagnosed with COVID, but they were admitted for other reasons. They were just found to have COVID when they were admitted. So this is the same pattern happening now in the UK. And as Omicron increases, I see no reason why the same pattern shouldn't be duplicated in the United States. So this is data as per the 21st of December. And of course, now it's the 29th of December. And as we saw from the previous graphics, the Omicron is even higher now. So this figure could be even higher. It could be even more advantageous now. So 20% of admissions caused by viral complications, 80% were coincidental on the 21st. So COVID patients in hospital on the 21st, 6,245. That was up 259, but of the 259, just 45 were admitted for viral complications. And of that same 259, 214 were having other conditions and just found to test positive. These are the incidental COVID admissions. So we see that of the hospitalised numbers in the United Kingdom, incidental admissions now outnumber viral complication admissions by quite a long way. And here's a graphic that illustrates that. This is the proportion of There we go. The proportion of increasing COVID patients being driven by true COVID cases, in other words, admitted because of COVID complications. So back here we see it was high in the middle of Delta. Now it's down, and it's right down there now too. Round about, as we've said, 20%, meaning that 80% of the patients in those figures are actually admitted for some other reason. So this is like the pathogenicity of Delta here, and this is the pathogenicity of Omicron here. It would appear from this data. Now the previous week, previous week, 7th of December to the 14th of December, the majority of hospitalisations then were still Delta, and then the primary cases admitted for complications of the virus were 59%. So down from 59% on the 14th, week ending the 14th, down to 20% on the week beginning the 21st. A substantial drop in patients being admitted because of viral complications. People currently in hospital, that's as of the 21st. Incidental cases estimated 1,813 out of that many. That was the highest number of incidental cases so far, but that's now gone up into that week, and we can assume that it's gone up even further into this week, although we don't have the specific data for that. Now, is this just me being a bit silly, or is this the consensus of expert opinion? Well, Sir John Bell, Regius Professor of Medicine, Oxford University, who's of course been involved all the way through, this is not the same disease we were seeing a year ago. The horrific scenes that we saw a year ago, intensive care units being full, lots of people dying prematurely, that is now history in my view, and I think that's likely to continue. This is, as we anticipated quite a few weeks ago on this channel, and it does seem to be coming true, at least for westernised, highly vaccinated countries, and I'm sure the United States is going to follow on a very similar trajectory. Chris Hobson, Chief Executive of NHS Providers, what our guys are saying is that incidental cases are making around 25 to 30% of cases that are arriving. Probably a bit higher than that, actually, Chris. Been out of date there, probably. But you do say that it's varying from place to place, which of course it is. In London, you would expect to see higher levels, of course, because there's higher levels in the community. In other words, the patients in hospital are to a large extent representing the patients in the community. And because the virus is so prevalent, of course, we're seeing it in hospitalisations. Lower in somewhere like the southwest, where community infections are lower, as you would expect. They are seeing an increase in the number of hospital admissions, but it's not precipitous. So there is an increase in admissions, but as we said, they're not staying for too long, and it's not precipitous, and it's not going up in an exponential way. Now, the number of cases has been going up in an exponential way, and by now, 10 days, 14, 15, 16 days later, we would expect the hospitalisations to be going up exponentially if they were that linked, but clearly they're not, because they are not going up exponentially. The admissions are drifting up slowly, but the total number of patients in hospital, as we saw, is not going up steeply, which is good news because they're not staying for as long. As the number of cases in the community rises, there are significant levels of incidental cases, of course, but we mustn't forget that having those people in hospital causes complications because of infection control measures, which is true. This is causing problems in hospitals. It's not that the problem's gone away. It's just changed a bit. And of course, lots of staff are off sick as well, under significant amounts of pressure, and are struggling with high numbers of staff absences, as we've said. So these patients are having to be isolated, lots of people off sick, so it's still a problem. Now, here's a graphic here, another one that's quite useful. So this is number of patients. So the green line here is total bed occupied by confirmed COVID patients. So that could still go up a bit because there's a lot of COVID around. So that could potentially go up a bit. But this red line here is confirmed COVID patients who are being primarily treated for COVID-19. As we see, that has been going down, and that's only for December the 12th. So we already know that by December the 21st, we already know that that's down to about 20% of patients, and we can expect that to go down further. So, in other words, a lot of these patients are diagnosed with COVID but are not in because of COVID. Only this number in because of COVID complications. These are going to increase the incidental admissions in for some other purpose. More cases of incidental COVID compared to previous waves. This is Dr. Raghib Ali, consultant acute medicine, Oxford University Hospitals. There is certainly a smaller proportion of people ending up with COVID pneumonia intensive care, and we've seen that from the figures. Not as many people are going to intensive care. It's remarkably good news. About half the patients that Dr. Ali's seen in the Oxford area are incidentals. Completely incidental cases, someone who's broken a leg. Then the third category of older people who have comorbidities. Now, these are harder to tease apart. Are they there because of COVID or for some other reasons? Maybe they have had a fall or chest pain and also test positive, and it's unclear if the virus is having some sort of impact or not. So these are more sort of query cases. Is the COVID infection bringing on a bit of chest pain? Is the COVID infection bringing on a fall? Of course, there's some confusion that the patients could fall. So that's quite possible. So these are kind of a grey area. And when the prevalence of the virus is relatively mild symptoms is high in the community, you will see higher incidentals, of course. And we saw this in Gauteng with 52% of incidental cases. So pretty promising looking, really. I remain optimistic about this. And as you'll see, I've got a bit of a cold today, so I've just done a test and haven't got it yet. There we go, still negative. I've still got about 7 tests left in this batch, so I'm going to keep an eye on it, and it's just a matter of time till I get a line there, but so far not. So that's the state of me so far. Now, just a bit of, I suppose it's almost historical now, but looking back to the Delta, and this is why the governments, I think, have been so keen on promoting vaccination. Let me just show you this data here. So now this is from ICNARC. This is the Intensive Care National Audit Research Centre. So all intensive care units have someone who spends quite a few hours a week filling out data on the computer that goes to ICNARC. All intensive care nurses are well familiar with this. And here we have the unvaccinated people in intensive care in red. And these are the ones with 1 and 2 doses of the vaccine. And we see it's quite a difference. So people that are unvaccinated, very high levels, much more benefit, of course, in the older age groups. There's actually 2 lines there, a line for 1 dose and a line for 2 doses of the vaccine, but you can hardly see the difference. So we see that during Delta, 1 or 2 doses of the vaccine, massively protective in keeping people out of intensive care. So that's why governments have been so keen on promoting vaccination. That graph explains it. It does make perfect sense that they'd want to do that, especially in the older age groups. The relative benefit is less in the younger age groups, but very important in this older age group, which is probably why governments, in the UK at least, put all their eggs in the vaccination basket. That the problem is, did they forget that eggs could go in other baskets as well, such as promoting immunity like vitamin D and zinc and things like that. And I think to some extent that is probably true. But that's kind of the rationale for their thinking. Of course, now we're into Omicron. We don't have the data for that. But so far it's still looking promising. Hospitalisations, as we've seen in some countries like Denmark, are going up somewhat, even as a result of the Omicron surge. But as we've seen, quite a few of those are incidental. So, and we've seen a lot of reputable people now who are much less worried about Omicron. So my contention that we made a few weeks ago that this is the beginning of the end is probably accurate. Now, bear in mind, we are all going to get this infection in the next few weeks. Almost certainly, if you live in the UK, you're going to be exposed to it. I'm sure you all know lots of people, lots of you have been writing in on comments that you have it or know friends that have it. And it's going to go all around the country, and the key thing is to make sure that you've got as good an immune system as possible, so you have minimal common cold type symptoms and bounce back in 2 or 3 days, and that's going to be true for the vast majority of us, as the hospitalisations remain low with a lot of incidental admissions. So feeling fairly hopeful, and that's where we're up to. Of course, we're keeping a close eye on it. We can't say we're quite out of the woods yet, But every day that goes past is the data to me is reassuring, and it's where we thought it was going, and it is looking promising. So we're changing from being a nasty disease to a endemic common cold virus that's probably going to be with us for a few years to come. But hopefully, because the Omicron is so transmissible, if a nastier variant did arise, a more pathogenic variant did arise, then hopefully it wouldn't be able to outcompete the Omicron. So the Omicron, as if it were, is occupying the ecological niche of this virus, and hopefully will carry on protecting us from severe disease in the years to come. So that's my assessment so far. We're keeping an eye on it. If I'm wrong, I will be back and showing you why I'm wrong. But so far, it's panning out as we anticipated, which is good. Thank you for watching.